Betty Sue from Vancouver.
Hi, Jamie.
Hi there.
Are you there? Oh.
Yes, I'm here. Is this the Betty Sue I know?
Yes, it is.
Hi.
Hi. Listen,
former state rep and council, well, it's not council, it was
County Commissioner.
Commissioner. I get them confused now, from Clark County.
Right.
Served our community for a very long time.
I don't blame you. First, I want to thank you for voting no on the House version of the health care bill, and also for paying attention to the sale of Bonneville Dam. We went through that process when I was on congressional staff way back in the 80s. But I wanted to just make a couple of observations for you.
Okay.
First, if we really want to reduce cost, it means someone in the healthcare system is going to have to make less, and no one will like that. Second, if the Republicans push too fast on this, you will pay in the long run, and I really appreciate your comments about taking this process more slowly. You may or may not remember that when the state legislature passed in 1994 health care reform, we lost both the House and the Senate in the elections of 1994. So be cautious and keep up your comments about a longer process. The third one is please try to work across the aisle. The 3rd Congressional District, dating way back, Frank, to Julia Butler Hansen, has been very successful at working across the aisle. And only if you work across the aisle will you come up with a health care reform bill that will be meaningful and that will last. The next thing is that I really appreciate your conversation about small business associations, and I want to point out that would matter to women who are in the aesthetics business. Neither my manicurist nor my hairdresser can afford to have insurance because they have no reduced costs. And if they were able to form an association, it would make it much easier for them to buy health care insurance. And my last comment, which you might anticipate from me, is that if people believe they have a right to health care, they have a responsibility as well, because all of our rights are accompanied by responsibilities. And I have always supported the Obama requirement for people to pay for insurance. I don't know what went wrong with Obamacare, and I don't know why the premiums have become so outlandish, but I do believe that they are. But somewhere along the line, we cannot expect to have health care rights if we don't take responsibility. So those are my comments, and I have been pleased with what you're doing. Even though I'm a Democrat, I still think you've done a good job.
Well, I appreciate that very much. I think I agree with a lot of your comments. I think I'm not afraid for someone to make less in the healthcare system if, I think right now the way the system is set up, that's one that this is another kind of take on it, but one of the reasons I didn't like Obamacare was it required, and this is, your point about rights and responsibilities is well taken. I think people do need to understand nothing is free, and if you're going to get something, you are going to have to put something in. The way I see us doing that looks a little bit different than everybody paying an insurance company or paying a fine to the government. I had a big problem with that because I felt like, if people talk about insurance companies right now are making record profits, which is true, even though our premiums have gone through the roof, even though, our deductibles are crazy, yet they're making more. And that part of me wonders if that's because every American has to either purchase their product regardless of how good it is or pay a fine to the government. And I think we've got to be able to do this better. And responsibility doesn't just mean buying into the system. Some of it means taking care of your health. and making better decisions, because it's, we know too much now about how you take care of your body and whether or not it impacts you in the long run. But I'm not afraid to tell certain folks, you're making too much. One of the things we're starting to talk about here is the cost of prescription drugs. And why are we paying more for the one product when some of our neighbors to the north get the same product for cheaper? And it doesn't have to do necessarily, everybody says it's because you have to negotiate, the secretary has to negotiate directly. I think some of it is because of antitrust issues. And we passed a bill off the House floor, which some people said we'd never do, I want to say a month ago now, that is breaking down the monopolies that insurance companies, they have an exemption from antitrust laws, which is ridiculous to me. It's like a government-sanctioned monopoly, and we voted off the House floor to break that up. And I think that is one reason, the odds are stacked against the small business owner and those who are trying to do business there. And I think we have to make that a fairer system. And that is, I think that's also, I think that complements a free market system. That, it's the opposite of crony capitalism. So I appreciate that, and I think I don't need to reiterate all your comments. I think taking this process more thoughtfully and with some circumspection means we're going to do better. And so rushing it through is the opposite. We're going to get into trouble. And I don't just mean the Republican Party. I mean health care for Americans, and that is the ultimate goal in my mind, is making that a better system. And so we need to do this right, because it's going to impact people's lives. And I think too, I don't know, this is one I agree in general. I think if an idea is a good idea, people from all parties can support it. I don't know how that's going to break down with healthcare. To be totally frank, I think because of the extra political environment right now, both with regard to the administration and the fight for who's going to control Congress, I don't know that either party is going to be giving too much help to one another in the healthcare field, because everybody's trying to use it to whack the other person, which is a shame in my mind. But for my part, I have taken, within my sphere of influence, I have worked to make sure that we're working on things. I find a Democrat to work with me on bills that are important to our region. I mentioned Kurt Schrader's working with me on the sea lion bill. Derek Kilmer is working with me with regard to an ocean acidification bill to help protect our shellfish growers and our aquaculture. I just introduced a bill with Tim Ryan. He is a Democrat from Pennsylvania to help with, ending chronic absenteeism. I feel like the more that we're able to demonstrate thoughtful problem solving as a group, maybe that'll rub off on some of our colleagues. So I appreciate your comments very much, and your willingness to take the time to share them.
You bet.
Thank you, Betty Sue.